Hi everyone, I'm Taryn.
And I'm Claire.
And we're doing our presentation on HIV and AIDS. HIV stands for Human Immunodeficiency Virus, and it's transmitted by lymphocytes and monocytes in blood, semen, vaginal secretions, and breast milk.
AIDS stands for Acquired Immunodeficiency Syndrome and is normally acquired down the line after being diagnosed with HIV if the treatment is not taken seriously.
Specifically, HIV affects a white blood cell called a T cell, and these T cells are the fighter cells, and they fight off germs and diseases. So this is going to be our T cell, and what happens is the HIV attacks the T cell, and it piggybacks onto the T cell and works its way inside.
Once inside, the virus completely takes over the T cell and uses it as a virus-making factory to make a lot more copies of itself. The newly made virus then leaves the T cell, goes on to infect and destroy other healthy T cells as they continue to multiply inside the body. HIV can be spread by sexual contact, sharing needles, or from mother to baby during birth. In the United States, since the beginning of HIV and AIDS epidemic, an estimated 8,460 children who contracted HIV from their mothers have been diagnosed with AIDS, and nearly 2,000 of these children have died.
The signs and symptoms of HIV and AIDS vary from person to person. The majority of people infected with HIV will develop flu-like symptoms a month or two after the virus enters their body. And some of these symptoms include fever, headache, muscle aches, rash, chills, sore throat, mouth or genital ulcers, joint pain, and diarrhea. If you receive no treatment for your HIV, the disease will typically develop into AIDS.
HIV and AIDS is most commonly diagnosed by testing the blood or the saliva for antibodies. It can take anywhere from 6 weeks to 6 months for these antibodies to present themselves. Once you're diagnosed with HIV, there are certain tests that the doctor will run to see to what extent the disease has progressed. One specific test counts the number of CD4 helper T cells. A person normally has 500 to 1,000 cells per microliter of blood. When a level of 200 cells per microliter is reached, a person is then diagnosed with AIDS.
So Claire, if you had HIV, your healthcare provider would suggest medication management programs, support care, mental health care, food assistance, support groups, and activity groups. And your healthcare provider would also provide tests such as a complete blood count, a urine analysis, STD testing, blood chemistry profile, and more.
There is no drug that can cure HIV. However, taking 3 different HIV meds does the job of controlling the amount of the virus in your body and protecting your immune system. There are currently 5 different classes of HIV drugs, and each class attacks the virus at different points in its life cycle. Those on HIV medications will take 3 different antiviral drugs from 2 different classes. By taking these 3 drugs together, the HIV in your body will be less likely to make new copies that doesn't respond to your HIV meds.
So this is my client, Deb, and Deb just found out that she has HIV, and Deb experiences decreased range of motion and coordination. She also has incontinent bowel and bladder movements. She experiences weight loss and neuropathy.
I also have muscle weakness, and I get really tired really easily, like fatigue hits me like that. This is Jamie. She's 8 years old and has been diagnosed with HIV. She has issues in motor, speech, and independent living skills. She also suffers from spasticity, rigidity, tremors, and sometimes seizures.
So for treatment for Deb, she had mentioned that she was experiencing a lot of fatigue. So something that we could do as OTs is help her brainstorm energy conservation techniques. And we could also help with her muscle weakness, help her with strengthening and increasing her range of motion. And also, she had mentioned to me that she wanted to get back to work, so we could also maybe do a work site evaluation to help her out.
With Jamie as an occupational therapist working with her, we'd work on independent living skills such as dressing, bathing, getting yourself ready for the day. We'd also maybe hook her up with some support groups because she might have some psychosocial issues and scared of what the future is going to bring for her. HIV and AIDS are prevalent in children all the way up through adults. You can be born with it or you can get it as an adult. You need to be aware of the signs and symptoms and what happens when you do get it. You also need to be aware, even if you don't have it, that you can get it. As occupational therapists, we are there to help you improve your quality of life.
Yeah, and I really think that as OTs, we play a large role in educating the client and their families on what it is, and also what OT can do to help them become more independent.
Thanks for watching! Anyone can get HIV and AIDS. It doesn't matter your age. It doesn't matter. The activities of daily living and get them out to normal life. That was bad.
So, optimal performance in the environment. I just took your line.